Welcome to the Win Big Charity podcast about SoccerFest. Today we have our guest, Jessaca Rodriguez from the American Heart Association. Thanks, Jessica, for joining us.
Yeah, my pleasure. Thank you so much for having me, Alex. I'm so excited about our conversation.
Yeah, well, a lot of people know what the American Heart Association is, but they might not know a little bit of the details about the American Heart Association. It's one of the charities that's dear to us. Our president has heart issues. Everyone probably knows someone that's had some heart health issue. There's a lot of people that don't know they have heart health issues. So to us, it's a pretty important topic. And that's one of the reasons why we chose the American Heart Association as one of the charities we support with Win Big Charity. Now, can you tell us a bit more about the core mission of the American Heart Association?
Yeah, absolutely. Well, as you mentioned, I think we all probably know somebody who has heart disease or has experienced cardiac arrest or a heart attack or even a stroke, because we're actually the American Stroke Association as well, which a lot of people don't know. But the American Heart Association is really dedicated to fighting heart disease and stroke, the number 1 and number 5 killers of all Americans. And, we consider ourselves to be a relentless force for a world of longer, healthier lives. That's our mission. So while we are focused on fighting heart disease and stroke, from like a national level, the only way that we know that we'll be able to accomplish that and reduce deaths from cardiovascular disease and stroke is by looking at health from a holistic standpoint. So we're really focused on driving those healthy outcomes that are in turn going to reduce deaths from both heart disease and stroke.
Nice. And how does, I guess there's one of the questions a lot of people do have is how has research funded by the American Heart Association led to groundbreaking treatments?
Yeah, so we've actually been around for over 100 years, which is exciting. So just earlier this week, we celebrated our 101st birthday, which we were thrilled about. Last year, we celebrated our centennial. So over those 100 years, we've certainly led the way and paved the way for a lot of groundbreaking treatments that people still use right now, and we're still not done. So, for example, CPR training was something that the American Heart Association funded the research to actually tell us what is going to be most effective whenever we're encouraging people to perform CPR to literally save lives. Clot-busting drugs, which are used to treat people who have strokes and save their life. Cholesterol lowering medications, surgical techniques. So there are so many innovations that the American Heart Association really led the way on, discovering that literally save lives at your local hospital, your local doctor's office every single day.
Wow, 100 years is a long time. I don't know if a lot of people know that it's been 100 years. That's pretty impressive.
It is. It is really impressive. We were founded in 1924. We actually were founded by a handful of cardiologists who were inspired by a social worker, who, really encouraged them to do more whenever it came to treating heart disease. And so we've had a very, very rich history since then. Obviously, we've grown to be a far larger organization than just that handful of cardiologists. And we have a lot of work to do over the next 100 years, long after you or me are still living on this planet.
Yeah, that's true. I didn't know the CPR thing too. I've taken the CPR classes before, and I know a lot of people that have. And I've never had to do it. I've never had to use it, but I do know people that have, and I think it's pretty important, and it's probably one of the easiest trainings to do to be able to help someone in a situation like that.
Yeah, absolutely. And we always tell people, you don't even have to be certified to perform CPR. We're actually really pushing a national initiative right now and down at the local level too, called Nation of Lifesavers, because currently, as it stands, over 65% of Americans have told us that they don't feel confident or know what to do whenever it comes to performing CPR or even using an AED. And so we're really trying to break down that barrier. Anybody can do CPR. Kids as young as 6 years old can actually coach an adult on what to do in case of a cardiac emergency. And it's super simple. It's just 2 steps, push hard and fast in the center of the chest, call 911. And if there's an AED nearby, you can grab that, and the AED will literally talk to you and tell you exactly what to do in that emergency until paramedics arrive. So definitely a huge priority for us because we know that so many cardiac arrests occur outside of a hospital setting. In fact, over 90% of them do. And unfortunately, in 90% of those cases, the victim dies because they didn't receive CPR by a bystander. So huge priority for us, just continuing now to kind of spread that education and spread the word, and ensure that as many people know how to act as possible.
That's interesting that even a child can help save someone. That I didn't know that. That's very good.
Yeah, we actually had a story out of, I believe it was out of Tennessee, but there was a young 6-year-old boy, and the American Heart Association came in to his school a couple of years ago, and they did a very like child appropriate demonstration on how to act in case, they saw an adult or even another child go down and into cardiac arrest. And the very following week, the child was at church with his mother, and one of the congregation members went down in the church. This boy really took the lead. He told his mom, call 911. We're going to put your phone on speaker right here. Nobody else in the church was acting. He coached his mom through the chest compressions and doing CPR, and they ended up saving the gentleman's life. So that story was really inspiring for me. I have a 5-year-old son. I think in the next couple of years, I'm going to make sure that he knows exactly what to do, because you just never know whenever cardiac arrest can happen at any time and to anyone.
Yeah, that's true. And children, they're like sponges, right? So if you get them early
Exactly.
on, and it kind of sticks with them.
Yeah, and they want to help, kids want to
Yeah,
help.
yeah, exactly. Now, can you tell us what the biggest misconception is about heart disease and prevention?
Yeah, I always hear, so I would say there's a couple of misconceptions, but I think one of the biggest ones that we hear really, really frequently is that heart disease only affects older adults. We even frequently hear heart disease is like an old man's disease. In reality, though, we are seeing folks suffer from heart disease younger and younger and younger. And it's actually the number one killer of women too, which a lot of people don't know. So it can affect people of any age. A lot of people are born with congenital heart defects. Now, today, thanks to the American Heart Association, babies are tested at birth and even before birth to see if they have those heart defects so that we can catch them early on. But there's a whole generation of adults that are living today that may be living with congenital heart defects because they haven't yet experienced any complication from them. But unfortunately, we do see many cases where these conditions just go unchecked for many, many years. And then one day they end up suffering, cardiac arrest or a heart related issue whenever that finally becomes apparent. So, huge priority for us is just educating that even if you're healthy, you're taking care of yourself, you may be doing everything right. Sometimes your genetics can go against you in that sense, or you might be living with a heart condition. So we really encourage everybody to see a cardiologist and just to stay vigilant whenever it comes to their health.
And how does lifestyle, diet, exercise, how does that impact heart health?
They're everything. So, I just mentioned genetics. So yeah, like your genetics can impact your risk of heart disease or stroke, but the good news is that you can reduce the chances of that happening by caring for yourself whenever it comes to lifestyle changes. So definitely diet, exercise. We found that just 30 minutes of moderate physical activity per day, eating more fruits and vegetables, and then managing your stress can significantly reduce your risk whenever it comes to heart disease. So it's really not just about genetics, it's also about those daily choices that we make.
Yeah, that's true. I mean, even taking walks. I tell people that don't do a lot of physical activity. I'm like, at the minimum, you should be like walking every day
Yeah.
to kind of help your blood flow get going. So yeah, that I can see how that impacts it.
Yeah.
Now, you got how does like these grassroots events that happen, um, how does that help your fundraising? Like like our soccer fest.
Yeah, we're so excited for the upcoming Soccer Fest, right around the corner. Well, a few months out anyway. But those events are really, really critical whenever it comes to organizations and their fundraising dollars. These events really bring together people together around a shared purpose. They're fun, they're engaging, they create a ripple effect to, when one person shows up, they inspire others to care and to give back and participate in these types of events. So they really help people, connect those dots between something that they love, like soccer, and then something like that matters, like saving lives through the charitable organizations that you all are supporting through the tournament.
Now I'll ask you a little bit of a personal question. What motivates you in the fight against heart disease?
Yeah, that's a really, really good question. So, I've personally been with the American Heart Association for a little over 11 years. I started my career at Heart in 2014 in Houston, Texas, which is where I'm originally from. And I actually started out as a communications intern, not knowing much about the American Heart Association. I had seen like our heart health check mark on food at the grocery store that had been approved by us as being heart healthy. And that's pretty much it. Like I knew that we fought heart disease. In my first 3 months of interning with the Heart Association, I lost two family members to cardiac arrest. I lost my grandmother, who unfortunately went into cardiac arrest while she was home alone. Nobody was there to call 911. She collapsed before she was able to get to her phone to call 911 and ultimately passed. And then shortly after that, I actually lost my 23-year-old cousin who went into cardiac arrest in public at a restaurant. And there was not an AED nearby. Nobody rushed in to perform CPR on him. And unfortunately, he did pass away. And that was due to an undiagnosed congenital heart defect that he didn't even know about because he had never experienced any symptoms prior to that moment. Um, so it's definitely really, really personal to me. Heart disease runs in my family. And then over the last 11 years working with this organization, I've heard so many stories and met so many individuals and survivors and families who have, suffered similar experiences, and that's their why. So, in a way, all of these whys have kind of collectively become my why too, and it really drives my work every single day.
I'll tie in a little bit about our event. We're three founding members of the Win Big charity, and we're all soccer players. So uh,
That's
we've all
awesome.
played at different levels, and we all met through soccer at various times in our lives. And that's one thing that personally that where I haven't played since the pandemic kind of put a stop to kind of everything, right? And it's been hard to get back into it, but recently I've found the time to kind of get back into shape because I want to start playing again, even if it's just pick up once or twice a week, uh, you know. And part of the event is we're gonna have some live music there, and I know that part of like a healthy heart is lowering stress, and music is part of it. Music is and physical activity are part of it. And can you talk about a little bit about how to maybe reduce stress to help the heart?
Yeah, absolutely. I mean, reducing stress is really, really critical whenever it comes to reducing heart issues. I mean, whenever we're stressed, our blood pressure increases. Blood pressure is the number one risk factor for stroke, one of the top risk factors for cardiac arrest. It's so, so critical that we are doing activities that we love, like soccer for you. I also like soccer. I used to play in high school, haven't played in many, many years. But whether that be listening to music, de-stressing in that sense. Any of those activities are absolutely critical whenever it comes to taking care of yourself, taking care of your mental and your physical well-being. And we know that somebody who is high stress is probably not going to be making the most healthy habits or changes to their lifestyle that would be conducive to, reducing their risk of heart disease and stroke. I know whenever I'm stressed, I can't sleep. Sleep is a big deal whenever it comes to reducing our risk for heart disease and stroke. Probably not choosing the best foods or most nutritious meals to eat. It truly does create that domino effect that can lead to greater risk for heart disease.
And are there like early signs of heart disease that are easier to kind of like pinpoint for someone than others?
Yeah, they call it the silent killer. So for a lot of people, there aren't a lot of signs, but what we always say is to know your numbers. So make sure that you are getting, checked out regularly by a physician or by a cardiologist or a doctor, know what your blood pressure is, monitor that in a semi-regular fashion, know what your cholesterol is and your blood sugar levels, because all of those numbers can really paint a picture whenever it comes to risk factors for both heart disease and stroke.
Nice, that's good to know. Now, combining everything we've talked about so far, is there a message that you have for anyone out there that wants to know more about heart health or more about the American Heart Association? You know, what they can look for, where they can go?
Yeah, absolutely. Well, if anybody would like to know more about the American Heart Association, I definitely encourage them to visit heart.org. That's HEART.org. And also, I just, want to share that you have more power than you think. Simply learning CPR could be a huge outcome in somebody that you love's life. You could save a life just by having that knowledge, passing it along to your friends and family and network so that they know how to perform CPR is crucial. And just sharing, how to ensure that you're reducing your risk for heart disease and stroke is really, really critical in creating that ripple effect and making change whenever it comes to supporting the American Heart Association's mission, which is ultimately to save lives and ensure that everybody can live a healthy, long, and full life.
Nice. Well, thanks a lot for meeting with me today. It was very informative. It was very nice. I can't wait for our event. You guys will be there at our event on
We
October
will.
18th.
Mhm.
And we're building this to be the biggest soccer celebration in Florida. So we're hoping to have a lot of people there. Day of soccer, day of music, some good food, and you guys be present as well at our event. So thanks again for joining us today. I hope you have a good day, and we'll definitely be talking again soon.
My pleasure. Thank you so much for having me, Alex. We're really looking forward to October 18th.
Awesome. Thanks, Jessica.
Thank you.